You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, Dr. Bo. How are you?
Good. Hi, how you doing, Dr. Franco?
I'm great. Thanks for coming over.
Yeah, of course. Happy to be here.
Why Youlify?
Great question. It's probably been the fifth or sixth time I've been asked that this week. But I think Youlify symbolizes kind of a very important inflection point in my career and personal life. I am a former cardiothoracic surgeon and emergency physician, and Youlify was a company and business that came out of my own personal pain point and journey during the pandemic. I was the department head and director and hospital executive for our emergency room. And as you probably know very well, as being a physician yourself, this is a very challenging and trying times for all physicians on the front line, risking our lives, providing services, and just try to do the best that we could with very limited resources in the beginning. Being kind of the department head, I'm in charge of clinical operations as well as financial operations. Clinical operations, namely patient care and making sure patients don't die. But financial operations, medical billing, operations internally, externally, working with vendors. And you know it's very well, we are not trained to be accountants, CPAs, and CFOs, and kind of just be very financially driven. Although as physicians, we're all very data driven. I kind of learned the hard way that medical billing and financial operations was a significant problem, frustrations for a lot of hospital administrators and physician executives. So we lost a lot of money during the pandemic and had a difficult time sometimes fairly compensating the physicians and other providers underneath me. So Youlify was my personal and entrepreneurial journey as a reflection of that critical juncture of my life.
Yeah, it's a very interesting answer, and I would say motivation that got you to start this enterprise. And
Yeah.
as you said, I think as doctors, we know from our colleagues that 99% of us don't have any clue about medical billing.
Yeah.
We do our job, we do our clinical care, we take care of the patient, but when it comes to reimbursements, it's a nightmare because
Yeah.
not only then we have no idea how much we get paid, but most of the time we leave that issue to people that have no clinical background and they have no clue what to take care of a patient means, but they
Yep.
they get they get the financial aspect of it. It's a nightmare.
Yeah.
Billing, it's a
It's
nightmare. And
yeah.
I can't say I've met any office, medical
Yeah.
office or doctor's practice that is happy with the billing issue.
Yeah.
How do you solve this
Yeah.
matter?
You are very eloquent in describing something that is a quote unquote nightmare, unfortunately for us. Literally just got off the phone 20 minutes ago with another physician executive, and he's like, billing, swear word, really sucks. Um, it sucks because I think you touched a lot of key points, to do it's the people who do the billing. Let me paint an image for you. It is somebody, and this is not meant to be condescending, but this is just reality, right? It's somebody who is making a little bit above minimum wage. They're sitting in the office remotely or at home and or maybe in Pakistan, India. Um, they're paying the hourly wage to do our billing. And there's no direct understanding or empathy of the blood, sweat, and tears that we put in as physicians and the sacrifice that we make, and sometimes putting our own lives, especially during the pandemic, at risk for providing that patient care. The amount of complexity from an operative standpoint or procedural standpoint, and the sheer amount of time that you do in some of the big cases, whether it's a dissection or a thrombectomy or catheterization or a knee replacement, sometimes it's not as straightforward as it seems. So the question is, are their financial incentives and emotional incentives aligned with us as physicians? And the answer is absolutely not. And then on top of that, we are in an ecosystem, a very legacy, antiquated ecosystem for billing that is broken, artificial rules created by payers, insurance companies that have their own intentionally designed bottleneck for physicians so that we don't get paid at the end of the day. And a lot of artificial rules that are made up for no good reasons. And not to mention the clearinghouses, the payment systems, the transactions, and trying to track that claim back in the ecosystem of ERAs, EOBs, EFTs, all these fancy acronyms, and then whether that money goes into your pocket, and then we got to make sure it balances out because it never does.
Yep.
So for a physician to understand this complex ecosystem, it is very difficult. And many times we don't want to think about it. So how do you tackle this? When I fortunately met some of the smartest people in my life, somebody who created the foundation of ChatGPT and somebody who beat Google in enterprise AI search about 8 years ago. I'm like, you guys are smarter than I am, and I am just a lowly physician. But let's tackle this problem, and let me share you my insights. And let's just take away the whole pain point for physician owners, practices, independent physician associations, MSOs, and hospitals, because nobody really wants to think about it. Let's take full responsibility. Let's segregate of what we can do and replace and take over with AI, but let's also be responsible and ethical and segregate part of the billing that really requires human supervision, where it's more of a complex case, some of the more edge cases for denial management. And let's break this down and let's capture the whole system to make sure the money really flows back to the physician.
It comes down to codes. And I never understood this in the first place. Why a procedure and the complexity of the procedure performed by a physician, could take anywhere from half an hour to 4 hours.
Yep.
It's distilled in a medical billing system to one code.
Yep.
And that code is paid a certain amount of money, fixed usually, by many insurance companies. And there's no flexibility on it. And if you miss that code, you don't get paid.
Yeah.
It's a very antiquated dinosaur type of system that needs to be changed from within. What ideas do you have to change this?
Yeah, I mean, I think that's been a very commonly asked questions. Obviously it's very hard for us physicians who are playing the game to dictate the rules of the game. Obviously, there are organizations like the AMA and everybody else who kind of designed this game. But you describe exactly
Our lobbyists,
insurance. We're just pawns in this game, right? We're just pawns. Let's just be honest.
Right.
But billing is a large ecosystem, and you highlighted one of the most important components, which is coding. And right, for the people who don't know what coding is, and I'm sure there's a lot of physicians in the audience, but coding is both diagnostic ICD-10 codes as well as CPT codes, procedure codes. But that's just professional billing. There's also facility billing for using an OR, hospital, nursing facilities, everything else, et cetera, et cetera. And then on top of coding, there's also modifiers. And then you described something like maybe the knee replacement or the procedure I did was more complex than the usual typical case. How do I capture that? And then that's where something like, for example, modifier 22, not to get into granular details, would capture something like that. But I think the better question to ask, and you brought a very important point, is it's not just how do we replace this game, because we really can't, right? For the individual peon in the system.
Yeah.
It's more of how do we level the playing field against insurance payers and the arbitrary rules that they create. A lot of it is clerical obstacles. A lot of it is understanding coding complexities and how do you really capture and quantify service. It is never fair in my eyes to say, let's put a number on something that we provide as a physician. But in this imperfect world, how do we augment that ability to capture the service we provide? And this is where I truly believe that AI, we have optimized coding beyond some of the own coding that's created by physicians, inputted by physicians in the EHR or billing claim, and or billers and coders themselves. So our goal is to always supervise and to make sure that is the highest level of coding and complexity to make sure we get reimbursed at the highest level.
Another issue that I encounter a lot in the stories that I hear is the fact that most physician practices have a set amount of reimbursement per unit from the insurance company contracts. And those contracts, not only that sometimes they're not even allowed to have a contract, but when they do, they're not renegotiated for years and years.
Yes.
And they're not even updated with the regular inflation rate of the nation. So this is a big issue for, no matter how good coding is, when you
Yeah.
get the same rates of reimbursements for years ongoing and you're not able to update those, where do you go from there?
Yeah. Yeah. Um, this coincides with another conversation. I had a physician who, a very successful, productive orthopedic surgeon in California, and he had not renegotiated his contract schedule fees, his rates with a large insurance plan for more than like 8 or 9 years. He was getting paid at 70% of CMS Medicare reimbursement rates. So it's like, I'm the specialist. I'm the only game in town. Everybody comes to me for all the complexities, and I get paid less than Medicare rates. So he's just like,
Just a
and I,
caveat here, the Medicare rate, just
yeah,
describe what the Medicare rates are. So
yeah,
everybody can have a, point
yeah.
of reference.
Yeah. I mean, Medicare rate's just like, what CMS determines as a fair rate for, let's say, a knee replacement or a procedure or
Right. And
surgery
they're
or service
usually
level.
minimal. Yeah.
Yeah, and they're a reference rate of like a reference for a lot of plans to say, all right, well, we'll give you a value-based stipend, take care of our patients, and this is what you're gonna get. And yeah, he was at 70%. And I was like, why did you never renegotiate your rates? You're the only game in town. You do hundreds of cases, high hundreds, a number of cases in a year for complex joint takebacks. He's just like, I never got the data for my biller. I
Hmm.
couldn't really break it down. I didn't have time. I don't know how to. And I'm also afraid of offending the plan. He's
Hmm.
like, I honestly just feel helpless. And I'm a little
Yeah.
hesitant to do that.
Right.
So it's kind of like, I don't want to offend the person. I don't want to bite the hand that's feeding me, but I know I'm being treated unfairly. So we're like, well, you take up all the volume. You have really good mortality outcomes. And like I said, patients love you. Let's use those three main points and renegotiate for you. And actually, we just successfully renegotiated to 100% for him last week.
That's amazing. This was one of my next questions. How do
Yeah.
you get through to even open the discussion with an insurance company to
Yeah.
renegotiate the contract?
Yeah. 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 Excellent question. And let me touch upon one last point, which is the macroeconomic trend of what you brought up, right? Fifth year of declining physician reimbursement, and adjusted for inflation compared to the last 20, 25 years, uh, physician salaries have gone down 33%, right? At a minimum. So it's like we made less than what we did in the mid to late 90s.
Yeah.
So yes, renegotiation is really important. And how do you approach that? So data, any decision you make is data driven based on volume, productivity, and very low mortality, morbidity outcomes. So the game strategy I say is like, look, get a great billing software. And that's what Youlify does, is that we capture all your data from performance by CPT code, based on payer reimbursement rates, and just based on hospitals or your own individual provider level. Like, so if you have a group of 10 other physicians, you kind of see what everybody's doing, right? As the
Right.
physician, president, or owner.
Yeah.
Then based on that, you kind of look at your competitors within the geography and say, look, like I do the bulk of these complex elbow surgeries. So that's one. Get the quality data from the hospital that you operate. And there are definitely quality committees that you can get that data about myself. Be like, look, I rarely have a readmission. I really have a post-operative infection. And patients love me. Here's my press gaining score. Here's my Google stars here. Combine that and just say, look, I'm one of the only games in town. I plan to stay here. This is my home. I provide quality service. I provide high volume quality service. Please compensate me fairly. Like, I'm not trying to go from 70% to 200%, but at least pay me up to Medicare rates, right?
Right.
So that
Right.
was the
It's
strategy.
it's almost like begging, you know? And it's sometimes it's so demeaning
Yeah.
for uh being, treated this way, because I can imagine someone, like a practitioner, like you just mentioned, right? With a
Yeah.
very high volume,
Yeah.
quality care in the
Yeah.
community for so many years, going back to an insurance company that
Yeah.
doesn't want to even recognize him as a main
Yeah.
provider and pays him below the market. Um, it's demeaning.
Yeah.
It's something that strikes a chord in the professional community. To be able
Yeah.
to recognize that we can't even go to an insurance company
Yeah.
to get the right compensation for our service. What about the small guys? What about
Yeah.
a small group, a small
Yeah.
practice?
Yeah.
They don't even count. How do you make them show up in
Yeah.
this
Yeah.
renegotiation
Yeah.
scheme.
Yeah.
It's very hard. It's very hard.
Yeah. Yeah.
Um,
Um, yeah, no, very well said. We're easy to squeeze. We're easy to be bullied, right? And this is why more IPAs have emerged to have more leverage, strength in numbers. But even that's not enough, right? I think once again, it comes down to data. It comes down to the service you provide, and it comes down to financial empowerment. Why? I think independent physician practices and with the recent AMA data that came out, were fewer and fewer. And now it used to be like 80-20 independent physicians and employed physicians, and now it's 40-60, right? And that trend will probably progress a little bit. However, I do think we're approaching a perfect storm from macroeconomic trends of reimbursement and administrative waste to too much monopolistic behavior by corporate medicine. And at a certain point, independent physicians, if you run your operations and your billing and just your whole workflow efficiently, you can have a very sizable profit margins. And I don't think that's a greedy thing to say as a physician and as a physician administrator, but that empowerment shows the light to others, right? And so when I tell people like, we don't just do billing. We provide a service and we're outcome driven. We make you more money, but a lot of times we have a discussion with these physicians to say, look, here's your RVU data. Here is your payer insurance performance data. Let's take that and let's find the most productive codes and procedures and do more of that, right? And then you're not going to feel guilty or powerless when that large healthcare system knocks on your door and say, we want to buy you out. And you really don't have a choice because you're in the red or you're barely making a profit and you feel like you have to sell. But if you're
yeah,
making a healthy profit cushion, you have choice. So that financial empowerment is about giving choice back to physicians so they can say no because I make plenty of money. I'm happy and I can spend that extra time with patients.
yeah, yeah. Very good idea. But let me go back into your mindset a little bit.
Yeah,
As a physician, all of a sudden you decide not to be a cardiothoracic surgeon,
yeah,
not to be an ER physician management position, and you start this enterprise with with a totally parallel service from what you used to do clinically.
yeah,
What happened in your mindset? Why?
yeah, yeah. It's excellent question. I think it had to do with the fact I wanted to take back control. And I think, just like yourself, I think we want to have our own voice and have a systemic impact and influence to redirect our profession and healthcare field to make it feel like we're helping pivot our field and as physicians in the right direction. And, my first inkling when I was still a naive cardiothoracic surgery resident in New York. I love operating, but there was no room for creativity, thinking differently, and just, it's just do as you're told. That takes away a lot of your motivation. Just kind of like, when you renegotiate with insurance companies, they keep on saying no. You're like, oh man, like I'm not gonna try again for the next 5 or 6 years. It's a waste of my time. I'm just wasting money and time. It's very demotivational. And I had a glimpse of startups and working with engineers, product, uh, at a venue at MIT, and I was like, this is like reinvigorating. Like it felt very challenging personally, and I wanted that flexibility going to emergency medicine. And even when I was on the administrative side, uh, I wouldn't say I enjoy being an administrator and looking after finances and making sure I'm delegating responsibility and having that responsibility come back on my shoulder when I can't directly touch the patient. But I did see that understanding the dynamics and the cogwheel of what drives healthcare, like don't be part of that cogwheel, right? Turn that cogwheel, have your own voice, and maybe get rid of that cogwheel and create a machine that reinvests back to physicians. And I also saw that a lot of administrators were not physicians. And when you try to, and you probably know this very well, when you try to tell non-physicians what you need for patient care or better operations or, what that money means, it's not on deaf ears.
Yeah.
And corporate medicine is hard to hear those voices. And entrepreneurship and starting your own company, I felt like I could really just set my own path.
Yeah, I think Look, I need to congratulate you because I think the fact that you come as a physician in a field like this that most of us have trouble with, and like you said, we're dealing with people that have no clinical experience. They're just,
Yep.
maybe no numbers or billing. But you being a physician and leading such a company that can help kind of, you know, get get us back on track, at least
Yeah.
with
Yeah.
reimbursements, it's a very motivating example
Yeah.
for more and more people like you that can
Yeah.
take the reins of disturbing the status quo. I mean, we need to do something about
Yeah.
this. And yeah, congratulations on this like decision
Yeah.
of doing this because I
Yeah.
don't think many people would think of switching the way you did.
Yeah.
Another thing that I want to ask you is I'm sure you're very successful and you were very successful as a doctor and now as an entrepreneur. But I'm sure you had your setbacks and you had your
Yeah.
failures and you had your
Yeah.
things that didn't work out.
Yeah. Mhm.
Give us an example.
Yeah. I think it's plenty. And I think, and that's an excellent question because I what drives me is not success. What drives me, I'm sure you and a lot of very ambitious people are the reminders of the ghosts of our failures, right? But what's worse than a failure is not taking that lesson away. Um, some of my biggest failures, I feel, are I'll be honest. I mean, starting this company earlier, um, and just like I saw, I think my biggest regrets were when I saw and started to understand the system and how this healthcare works. Is that money at the end of the day really drives this whole engine of healthcare. And there's just so much administrative waste that,
Yeah,
private equity venture capitalists are now capitalizing on this and realizing that there are more efficient tools such as AI to capture this. But I saw this many years ago, and I my biggest failure was not acting on it and doing a deeper dive of understanding billing, reimbursement, and RCM, and why there are 390 plus legacy revenue cycle management companies out there, and why couldn't I build something different? And I'll tell you this, I'll be honest. I think I lacked the courage at that time. I lacked the courage to say, I'm going to take this big risk and really tackle this problem and be a servant to other physicians. I think that was a very humbling process. And that kind of haunts me a little bit, which is what drives my sense of urgency today, because I realize now this is a perfect timing with AI, but we're also in a much deeper hole as physicians with the fact that we're getting a lot less money than back before, and there's
yeah.
a lot more monopoly. It's like, is it too late? I hate saying it that way, but is it too late to now reverse that trend? So that is a type of opportunity cost that really
Yeah.
makes me feel a little regretful at times.
Well, I think this field in particular, I think it's very demanding for humans, and
Yeah,
I think AI fits perfectly into this field to optimize
yeah,
everything, for a better reimbursement. Describe to us exactly what is the service you provide and
yeah,
how, for someone who comes to you as a client,
yeah. Mhm.
what can you provide to him?
And you'll probably laugh when I say this. I would say everything. But honestly, that's what we do. And a better term to capture that is really what we call end-to-end revenue cycle management, the entirety of billing. And a lot of people are gonna be like, "Oh, that's stupid. You should just provide one thing and do it really well." I don't disagree with that. But that's not what the customer wants. That's not what the physician wants, especially some of the independent physicians, because it's rather than a modular approach to this, which we do have. Physicians, when you speak to them, they're like, I just don't want to touch billing at all. Just get me
Yeah,
paid. Like
yeah,
take away that entire pain point. Nobody
exactly.
says, you know what, just do part of it. I'll do the coding, and then I love spending more time putting modifiers. I love to track my numbers. I love to track my explanation of benefits. Nobody says that. Like,
Yeah,
come on, let's be real. But that's a lot of responsibility on our end. And that's exactly what we do. We don't just do billing. We're service and outcome driven. And what I mean by that is that in terms of that workflow, once the physician sees the patient and documents, sometimes specialists love to put their own codes in, and a lot of times they're not correct or they're missing modifiers. But once that's created, we integrate with electronic medical record system, capture all that, create the coding, optimize the coding, and create the actual claims form. It's something called CMS 1500 form, which captures the professional side of billing. Then we integrate with the clearinghouses, which are kind of the middlemen, and then connect also to the insurance portal and follow the life cycle of that claim all the way to the insurance side, where they're going to adjudicate and basically decide if we're going to approve or deny this claim, and then track it back again into the invoice itemized side of explanation of benefits, EOBs, and electronic remittance of ICRAs. Which basically kind of segregates the coding of what's owed and what's paid or what's not paid, as well as the financial outcome, that money that hits the bank account of the physician. Obviously, a big chunk of that, sometimes 20% plus, 25% plus, are denied. That is the tricky and one of the biggest pain points for physicians, because then a normal human biller needs to go back to the medical chart, read it again, read the surgery, look at the modifiers, go to the denial portal, try to understand the denial codes, a whole bunch of 1 to 4 hours of timely manual labor to appeal that denial. We have an AI that does that for you as well.
Yeah, I was about
So
to ask you, what is the difference between using the AI in your
yeah,
company and using
yeah,
a human
yeah,
being for this appeals?
yeah, exactly.
Yeah.
Now, like I said, we also try to take a very mature approach to this. AI is never perfect, and although we have minimal to no hallucinations, there are some new complex cases, whether it's a multi-component, trauma case, or it's just a very rarely done procedure or surgery. We do segregate that to our supervisory human layer of very experienced billers and coders who take that, will do the billing and coding, but then feed it back to the AI model to retrain it and make it better. So the level of automation, success, and denial rate appeal gets higher and higher. And we have something that's very important, which is called collective intelligence. And what that means is, for example, we have a network of multiple orthopedic surgery practices. And let's be honest, a lot of the denial patterns are very similar. So when we anonymize that data and learn from one practice that got denied by a commercial payer, we can use that understanding and logic and apply it to another orthopedic surgery practice. And that collective intelligence, and the more data we gather, the stronger our performance and outcome is. So that is the advantage of scaling and the advantage of that collective intelligence.
Yeah, very interesting. Do you provide a feedback to the clients that you have in terms of reports,
Yeah,
analysis of their billing system and reimbursements, and also maybe help into the fine tuning,
yeah,
with
yeah,
not getting claims denied, not getting claims lost,
yeah.
and dealing with the clearinghouses?
Yeah, excellent question. Answer is yes, yes, and yes. Going back to that physician, that orthopedic surgeon who didn't really want to renegotiate because he didn't have that data, right? One of our biggest problems is a lack of data transparency. He just doesn't know his data. He doesn't know what's denied. He doesn't know his productivity. So that's exactly what we do. So we have at your fingertips financial details of the claim status. We actually do a predictive modeling of what your cash flow looks like. We do a predictive modeling as well as show your current denial rate. We show the productivity performance by CPT code, payer performance, by clinic, by provider, whatever you want. We can provide that live and at your fingertips. And more importantly, every month we proactively send you a report, even though you have it on our platform. It's because, let's be honest, physicians are so busy clinically that we're not going to go
Yeah,
on the platform and take a look at it. Just hand deliver something that's neat and tidy. Let me take
yeah.
30 seconds, take a look at it. All right, I'm
Do
healthy.
you have your own software or do you use a
Yeah,
different software?
yeah. Yeah, no, we have our own proprietary AI model. We have our own proprietary AI billing software, and obviously we provide the service. So we're what you call a triple threat. So we kind of do everything. And on top of that, we do spend some interactive time by video or sometimes even in person with the physician owners to like, hey, take this data and see how it shapes your practice. And one of
Yeah,
them was like, hey, I'm a surgeon, but I didn't realize 65% of my revenue comes from office visits.
yeah.
So I'm going to stop taking calls so much and just see more patients and do injections. It's easier on my lifestyle.
Yeah, absolutely. It can mean make it or break it in a practice, in a small practice. The way
Exactly.
you adjust your revenue streams based on those reports, and I think that
Yep.
changes every month. And you
Yep.
have to have a complex, I would say, vision, retroactive vision of what you did
Yep.
up until then. Bo, I'll go back to you.
Mhm.
You have the wisdom of a clinician, and you have the experience of an entrepreneur. Um, with all that, if
Yep.
you look back to yourself when you started this whole thing, what kind of advice would you give to yourself?
Yeah. Oh, great question. I don't know if I would quantify it as wisdom. I would quantify it definitely by a lot of failures and a lot of life experience, and very, very lucky. I think, I'm sure you've had a lot of conversations with other physicians, and like, I'm sure privately they're like, man, I don't know if I would be a physician again, or tell their kids not to be a physician,
Yeah.
right? Especially in today's current world. I would definitely be another. I would be a physician again. Um, but I would be hungry to learn all the bits and pieces that are not clinical. Whether it's EHR integration or
Hmm.
HL7 or fire or billing or operations, and just kind of get my hands dirty and just never be fazed by people dismissing your questions. I think the smartest people whom I've ever met, regardless if they're physicians, engineers, or product, or people like yourself, they're just naturally inquisitive, but their curiosity is insatiable.
Yeah.
Like they're not going to stop at the first why, right? And then, same thing. I'm sure you're doing this podcast. I mean, you're learning a
Yeah.
ton from all these various diverse conversations, and I mean, you're just a sponge and absorbing everybody else's failures and lessons in life. I think we're taught to be in this hierarchical apprenticeship in residency training and in medical school to just fall in line and never question and stay in the box. I think I would tell all trainees, residents, fellows, medical students, don't ever stop asking why. And not only just ask question, go do your homework, go do your research. Because if we stop doing that, we will die as a profession and we will die as leaders in this society and in this field. And I think that's the biggest thing I would tell myself if I were younger.
I like this. Never stop asking why.
Yeah.
That's amazing. Um, what do you think about mentorship? You having mentors and you
Mhm.
being a mentor?
Yeah.
Because I think you are at the point right now
Yeah.
that you can be a great mentor for someone who wants to
Yeah.
kind of go in your
Yeah.
footsteps.
Yeah. No, it's a great point. I would say anybody can be a mentee and mentor, and I don't think it's an age-related question. If you want to learn or you want to teach, like that's absolutely necessary. I'm grateful and very humbled to have great teachers in my life. But I'll tell you what, I actually learned the fastest when I didn't have great mentors or great teachers, and it forced me to find a way on my own. Um, And it doesn't mean that I don't want to share my knowledge. I'll be more than happy to share my knowledge. And I know that my journey of learning is far from gone. But sometimes mentorship is knowing when to take a back seat
Hmm.
and not just speaking and giving
Yeah.
out advice. And sometimes it's just listening
Yeah.
and giving a little bit of a nudge. But I think it's very valuable and it's what pushes us to be better and to be great.
Amazing. Bo, how can we know more about you? How can
Yeah.
we get more of your services
Yeah.
and keep in touch with
Yeah.
what you're doing?
Definitely. Definitely. Last thing, I just want to extend my gratitude towards you for having me on, and my entire gratitude to actually all physicians. I think, like I said, I think it's a servitude, but instead of just serving patients, I want to serve physicians because we work so hard. I mean, it's delayed gratifications for decades, right? So, like I said, my personal statement and mission is I built this as a physician for physicians. And Youlify, Youlify, is not just a company. It's a servitude and giving back to physicians to re-empower us. You guys can reach me out at bo@youlify.com. Add me on LinkedIn. And I'm sure you'll probably have my link as well in the podcast. But I think giving back and re-empowering physicians is the greatest form.
I appreciate you coming over, and I hope everybody will reach out to you, because this is one of the things that can make or break your practice,
Yeah.
whatever physician you are.
Yeah. Agreed.
Thank you for coming over.
Yeah. Thank you so much for having me. Really appreciate it.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.